Welcome back. When you are on the fence on whether you need to seek medical care, how about just turning to a simple online solution to find out? Managing your health virtually is an option thanks to Mercy Health. Joining us this morning is Dr. Fred Rials. Good morning, doctor.
Good morning. How are you?
I'm well. Thanks so much for asking. Okay, so virtual options that are out there, what is it that Mercy Health offers?
So we have a couple different options. If you go to mymercyhealth.com, you'll actually find the options there. COVID-19 has hit us hard. It's backed away, and it looks like it may be having a little bit more of a surge again. So that's one option. You can actually screen individually and see if you're at risk. That's one option. And if you are, they will connect you with some of our testing centers or further advice. Second option is to do a templated visit with us. So there's a series of questions regarding situations such as a rash or a urinary tract infection that you can put in your symptoms and get a response back within an hour or two from like a text exchange. And then the one that we really prefer is a face-to-face video interchange with patients. And we can do that for problems such as a rash or urinary tract infection, or we can also do it for things such as ongoing conditions such as diabetes, high blood pressure, arthritis, where we can have a FaceTime-like communication with our patients that allows them to ask us questions. We can respond directly. So it's very synchronous. It feels just like you're in the room with the patient. The video is very good. The audio is good. And patients get a chance to engage in their healthcare in a different way than they might traditionally think.
And when is it time to maybe bypass that though and go in and just seek treatment? What types of things what kind of words of advice could you give on that side of things?
It is always up to the patient to say, I'm more comfortable seeing someone in person, but I'm not sure if that's the right case. So if a visit starts and between the patient and the provider it's identified, this is something more than what we can manage over the video or an interchange, we'll advise the patient and then give them options of coming in to see us directly or seeking more emergent care through an urgent care center or even emergency room. Obviously, things like chest pain and sudden shortness of breath where you can't breathe, a cut that is bleeding, those things need immediate attention face-to-face. But most other things can be managed, at least initially, by doing the video interface. We've done over 20,000 of those visits in the last couple of months. I've done several hundred. And what I found is that a patient may say, I'm here for my checkup, but I got this mole right here. And I say, let's get a little better look at it. They can send me a high definition picture. And based on that interaction, I'll say, you know what, I think I should see you. Let's have you come in tomorrow. We'll take a look at it and I can do a biopsy right here in the office if needed. Or we might have a case where the patient's having some pain in the knee, and we go through their symptoms. And once we see their symptoms, we can say, you know what, I think you should come in. Let's do a little bit more of an exam with this. So most things can be initially analyzed and taken care of via a video visit.
Wonderful. And if people want to learn more about this, where can they go to learn more about what it is that Mercy offers?
Yep. So mymercyhealth.com. You can just type in a Google search for Mercy Health Michigan, Mercy Health Grand Rapids, Mercy Health Muskegon. We are the fourth largest healthcare system in the country as part of Trinity Health. So don't need to have many search options to find your way to us.
Well, thank you so much for your time this morning.
All right. Thank you.
Absolutely.